Hey everyone, welcome back to the channel. Today, we're diving into something really important: healthcare fraud awareness. It's a topic that's not just about numbers and statistics. It's about real lives and real consequences.
So let's unpack what's going on in the healthcare landscape, especially with the recent spikes in enforcement against fraud. Stick around for some key insights and what you can do to stay informed and protected. So let's jump right in.
Healthcare fraud is, a huge issue right now. Just recently, the 2020 for National Health Care Fraud Enforcement Action revealed that a staggering 193 defendants were charged, and among them were 76 medical professionals.
Can you believe that? It's wild. These numbers illustrate just how serious the implications of fraud schemes can be, not just for the perpetrators, but for all of us who rely on these services.
Fraud schemes can take many forms. Think about things like unnecessary wound grafts, unlawful prescriptions, and even some shady telemedicine practices. They're not just taking money from the system, they're putting patients at risk.
It's really alarming when you think about the impact this has on healthcare costs and the overall trust in our medical system. And speaking of trust, let's talk about the current enforcement priorities.
The Department of Justice, or DOJ, is laser-focused on a few key areas. They're tackling the opioid epidemic head-on, which is a major issue that affects so many families.
Then there's the problem of unnecessary services and substandard care, things that should never happen in a system designed to heal.
Plus, they're looking into Medicare Advantage issues and violations of the Stark Law, especially those tied to COVID-19. It's a lot, and it's critical to understand what's at stake.
Now, let's reflect on how changes in administration can impact enforcement. It's a complex relationship, right? Political shifts can lead to changes in how aggressively fraud is pursued.
Historically, we've seen that fraud enforcement can act as a revenue generator for the government. It makes you wonder, doesn't it? The motivations behind these actions can change depending on the political climate.
For physicians and practices, there's a real risk of becoming entangled in these fraud schemes. It's easy to overlook the fine print when dealing with vendors and business arrangements. I mean, who hasn't felt the pressure to make a deal that seems too good to be true? These common pitfalls can lead to unexpected legal troubles, and nobody wants that.
That's why understanding legal and compliance considerations is, super crucial. Having legal counsel to scrutinize business deals isn't just a good idea, it's essential. You need to be diligent with payment structures and referrals.
If you engage in fraudulent activities, the consequences can be devastating. It's like a dark road that can really derail your career and your life. Now, let's not forget about some alternatives to traditional practices. There's been a rise in cash-based and direct patient care models. These can actually help avoid some of the pitfalls tied to traditional insurance and Medicare regulations.
It's refreshing to see more flexibility in how care can be provided, while still complying with state laws and maintaining patient privacy. As we wrap up, I want to reinforce the need for strong compliance systems. It's a bit of a heavy topic, but it's so important to seek legal guidance to avoid falling prey to fraud schemes. The more informed we are, the better we can protect ourselves and our communities.
So, what can we take away from all this? It's a lot to process, and I know it can feel overwhelming. But, on a positive note, let's be grateful for the awareness being raised.
It's a step toward accountability and integrity in our healthcare system. We can't take our eyes off the ball. I'd love to hear your thoughts on this.
Have you experienced anything related to healthcare fraud, or do you have any insights? Please drop a comment below, like this video, and don't forget to subscribe for more content like this.
Thanks for tuning in, and let's keep the conversation going. Stay safe and informed out there.